Great stuff. Okay, I'll stop waffling and formally waffle by using my slides. So my name's Ed Davey. No, I am not the leader of the Liberal Democrats. I am the Policy and Public Affairs Manager at Centre for Mental Health, and we are running today's event, and we run the Mentally Healthier Councils Network, which is what we're here to talk about, especially here in Yorkshire and the Humber. So thank you very much to everyone for coming and for participating today. Because we've got so many wonderful speakers, I'm not sure we'll get to kind of verbal questions at the end. So if you do have questions at any point, do post them into the chat. And it's also nice to know who is here present with us. So if you put in your chat, perhaps your name and your job title, if you have one, then we can kind of get a sense of who's in the room. And if you do have any questions, do post them in the chat or comments. We really would value that. So thanks very much for that. Right. So who is Centre for Mental Health? Well, we are the UK's leading mental health research charity, been going for over 30 years, and we support mental health equality through research, policy development, lobbying and campaigns. And we are commissioned directly by local and regional authorities, including here in Yorkshire and the Humber. We've recently done some work with Bradford City Council with a report that's coming out soon about racialized communities and mental health. So that's exciting. And also the NHS and others to evaluate research and co-produce work all over the country, including in your region. And here it's illustrated with a bit of work we've just done called A Mentally Healthier Nation, which is us leading a kind of manifesto as we go into a general election year, calling for various things around mental health that's supported by over 50 national organizations. So we're really proud to have done that. So a lot of you will know this stuff anyway, but let's remind ourselves of the mental health protective and risk factors that can be changed through action. So some of the protective factors in kind of order of importance are having a secure and sufficient income, having enough money for a healthy life, being treated fairly, having a positive experience of being parented, having a positive school experience, secure and decent housing, access to healthy natural environments, having the ability and access to exercise, healthy diet, abstinence from smoking and substances, and community connectivity and relationships. And I won't read out all the risk factors, but they're basically the opposite of those things. And that's important because, as you can recognize from that list or lists, a lot of what local government does has an interaction with those risk and protective factors and actually has more agency over them than most other parts of our society. So councils obviously host public health, including mental illness prevention, well-being, substance use, and prevention and treatment, and health visiting. They're part of integrated care systems. They host health and well-being boards and health watch. They commission and provide vulnerable adult and children's social care and safeguarding. They're the licensing authority for alcohol and gambling. They're the planning authority for housing, transport and green spaces. They're usually the biggest social landlord in an area. They're provider of parks, community centres, libraries and advice. They're usually one of the biggest employers and economic actors in an area, and they have a role in education. So you can see through all of those and other mechanisms, councils have a lot of agency around their residents' mental health. So what have we as Centre for Mental Health got to do with councils? Well, because we are so interested in mental health and because councils have such a lot of agency around mental health, we've always been interested in supporting local government to do this work as well as possible and to learn from them. And we started the Local Governmental Challenge over 10 years ago and recruited over 100 councillor champions who did fantastic work all over the country. And the last couple of years, and we will do it again this year, we've produced manifestos to give candidates ideas as they go into council elections. And as I say, we provide direct services, and we've done a lot of work, in particular with Greater Manchester in the north over the last couple of years, but also with many others, including, as I say, in Yorkshire with Bradford most recently. So now we're doing the Mentally Healthier Councils Network, which is like the successor scheme to the Local Government Mental Health Challenge. And that's because for many years, the local government mental health challenge wasn't funded. We just did it through the goodness of our own hearts and because we thought it was important. But we have got some funds from the Health Foundation, who are a charitable funder, to kind of give this a new boost. The network is slightly different because it's open to council officers of all kinds, as well as elected councillors, whereas the old scheme was targeted just at elected members. We've already got above 200 recruits. That's fantastic. And we want to recruit hundreds more to share information, best practice, and networking opportunities. And this is the third of 9 regional events taking place over this year. And we're thinking of trying to create a kind of report drawing on all of your best practice to create a kind of 100 mentally healthier council policy type document so we can share good practice that we come across. So if you've got any policies like that, do let us know. And we're thinking in year 2 to create maybe a sort of accreditation scheme that hopefully works with the Prevention Concord app that Public Health England and then OHID have been working on, and some of you may have heard of that or be accredited. You can help by promoting the network in any events and meetings or bulletins that you might share with colleagues. I'm sure Bethan will share these links with you on how to get more information, the sign-up sheet, and do let us know if you come across any relevant policies. They don't have to be directly to do with mental health. They might be to do with poverty reduction or child development or environmental improvements that have a mental health benefit, even if it's not directly about mental health. We're really interested in all of that stuff. And as I say, we can provide a range of useful services. So do get in touch with us if we can be of assistance. And I will stop sharing there. And look, everybody, modeling good practice. I came in on time. Hooray for me. No, you don't have to clap. It's fine. So I will now hand over to Caron Walker, who is a consultant in public health and chief officer in the lovely city of Leeds, where my nephew is currently finishing his PhD in engineering. He's building room-sized 3D printers. I have no idea what any of it means, but he loves Leeds, as I'm sure we all do. So, Caron, 10 minutes max, over to you.
Ed, thanks for setting the scene. Yeah, as Ed says, I'm Caron Walker, working at Leeds, which is a very large local authority, as you well know, but also worked across the region in smaller councils as well. I'm not going to talk about our specific work today. I'll leave that to Laura. But I've also been quite privileged, really, to chair mental health and suicide prevention community of improvement across Yorkshire and Humber for a number of years, which was originally set up by the Director of Public Health across Yorkshire and Humber. So I suppose I really understand the issues and challenges faced by all of us as public health officers across the region in our work to promote good mental health. As we all know, public mental health is a broad area of interest. And the work we often do is tailored to different settings. It might be different geographies and different communities. And like other local authorities that are on this call today, we've worked very well with the Centre for Mental Health for a number of years. And I know certainly our elected members have valued their support as in their role as mental health champions. And that's been a long relationship with Leeds across a number of years. But what I'd also say is that public health colleagues have also found the Centre for Mental Health resources and materials really helpful in supporting their work. And I know that's also been the case in other local authorities. And we've got colleagues today from Rotherham, and I know they've certainly valued that material. Certainly from my perspective, the Centre for Mental Health has got a key role in supporting the development of our evidence base, but also advocating with us to regional and central government, because we really do need to work together on this agenda. So I would certainly, it sounds like a bit like an advert for the Centre for Mental Health, but I certainly would encourage colleagues that perhaps haven't worked with the Centre for Mental Health before to take up their offer of support and work with them and work with us in developing our priorities. Ed's already mentioned the manifesto, and we go into a period where we know there will be interest from all political parties around the issue of mental health. And we need to continue this work and basically take advantage of those opportunities. So I'm really pleased that we have the opportunity to continue this important relationship across Yorkshire and Humber. So I really don't want to say much more because I want to hear from the speakers. So I'd just really like to thank everybody for attending today and see how we can actually build on this work across Yorkshire and Humber. So I'll leave it there, Ed, which is less than 10 minutes.
I may way less than 10 minutes. Thank you, Caron. And the tenors in the post for that lovely advert for all the wonderful things we do. But no, seriously, that's great to hear. I'm really genuinely pleased to hear that what we do has been of use to people, because that's literally our purpose in life. So thank you very much for that. And because Caron was so lovely to us, we've given another chance for a speaker from Leeds, which is Laura Hodgson, who's a public health lead, and I will hand over to you, Laura, so I don't use up any of your precious time.
Thank you. Thanks for that. I will just share my screen. Let's see how this goes. So we have an infographic to share with everyone today. So yes, thank you very much, Ed. So my name's Laura Hodgson, work with Caron as Head of Public Health, working on public mental health at Leeds City Council. So I'm briefly going to share today what the promotion and prevention elements of our public mental health programme look like in Leeds. I think when Caron and I were talking about this, really keen to do it, as I think I would really value from kind of being part of kind of a countrywide network focusing on public mental health and sharing, I think, what we're all doing. Previously, a few of you know I was in a regional role, and the feedback that I often got from colleagues was, you know, what is the evidence base for public mental health? What does good look like? And also the challenge around how do you develop a public mental health programme on limited capacity and when the determinants of mental health are so broad? And I didn't have the answers then, and I don't have the answers now. But in that sense, I think with it being an emerging area of public health, this has meant that we've all got really diverse and different looking programs across our region. And that in itself is great, because I think we've all got lots to learn across our region and wider in terms of what works and also what has less impact. So the public mental health programme in Leeds has been developing for a number of years, but as I said, it probably looks very different in different areas for lots of reasons, and there's, you know, lots more that we can build on in Leeds. So this is taken from our mental health strategy in Leeds. I'm going to focus on priority one. Priority one is targeting mental health promotion and prevention within communities most at risk of poor mental health, suicide and self-harm. And I do think there's been a bit of a step change actually in terms of the increased focus on promotion and prevention in mental health strategies across our region over the last 5 years, which is really encouraging. And we've got a strong focus on prevention in Leeds and on some of those kind of more upstream interventions. So promotion and prevention comes under priority one. And we have it kind of under 4 key areas. So increase protective factors for good mental health, reduce risk factors for poor mental health, reduce stigma and discrimination around mental health, and also reduce suicide and self-harm. So I'll briefly talk to some of the things that we're delivering under each of those areas. So first of all, I'm hoping you can see my clicker and it should open things. There we go. We've got in Leeds our public health funded preventative community development programme. It's been recently recommissioned. Its new name is Being You Leeds, and it's led by a consortium of 7 voluntary sector providers in Leeds, and including Touchstone, who Arfan's on the call today. And there are 3 elements to this service, and it's focusing on, in terms of excuse me, in terms of communities that are known to be at increased risk of poor mental health. And we focus on the 10% most deprived communities and also some of our communities of interest. And there are three key elements. So if we go down here, we've got wellbeing groups and activities. So we co-produce wellbeing groups and activities in our 10% most deprived areas in Leeds. And the key thing here is they are co-produced. They are based on what people tell us will protect their mental health, that will make them want to get out of their house on a morning. And we've got a really diverse range of activities. We have physical activity, sports groups, craft groups. We also have training and awareness sessions delivered as part of this intervention. Mental health first aid and suicide prevention, but it's targeted on organisations that might not have the resource to access this type of training to make sure that we have skills across the workforce of Leeds. And thirdly, we have a focus on anti-discrimination and addressing stigma. And we've re-established our anti-stigma partnership in Leeds, and we're currently reviewing what our priorities will be for 2024. Some of the other things very briefly, 5 ways to wellbeing. I think a lot of us in the region focus on 5 ways. It is an evidence-based approach. In Leeds at the moment, we're looking at the evidence base in terms of, is it best used as a communication tool? Or some of our voluntary sector providers have used it as an evaluation tool, or a way in which to kind of organise interventions. So that's something we're exploring at the moment. We are a signatory of the Prevention Concordat for Good Mental Health in Leeds, and we will be reviewing that this year. Training I've touched upon. We do have a breakthrough project in Leeds called Unfolding. This came out of the pandemic with a focus on the volunteer workforce. We got lots of feedback in terms of burnout in this workforce, that this workforce were holding lots of risk and such a valuable part of our system in Leeds. So we've developed this programme to support their mental health and well-being and increase their skills so that they're able to continue to support some of our communities most in need. And then finally, Mindful Employer Network. Leeds Mind are funded to lead our Mindful Employer Network in the city. And for this year, we'll be focusing on some of our smaller businesses and some of our employers in our most deprived areas in Leeds. In terms of the third area, reducing stigma and discrimination around mental health, I've already touched upon the anti-stigma partnership that we're re-establishing in Leeds, but we also have the Synergy Leeds partnership. Now, this partnership is addressing mental health inequalities within diverse communities. And we recently won a HSJ award for Mental Health Innovation of the Year, which is fantastic. Just had to throw that out there. But from a kind of public mental health perspective, there's a few elements of the programme, but one of the areas is a grants programme that we've had established since 2021, a 2-year programme that's funded 12 community organisations to support local people from ethnically diverse communities. And this is looking at increasing capacity, reducing stigma, increasing trust, early intervention. And we're getting some kind of really good feedback in terms of the impact that this grants programme is having. And this sits within kind of some wider work that we're doing that links to priority 2, an overrepresentation of people from Black, Asian and minority ethnic communities admitted in crisis. So it's a really important area of work for us in Leeds. And our final area is around reducing suicide and self-harm. I won't go into that in much detail today because I do feel, and again, got this feedback a lot when I was in a regional role at OHID, that our suicide prevention programmes are quite well established. There's a strong evidence base and there's lots of national policy that supports kind of the work that we deliver at a local authority level. But it is more in kind of the areas of public mental health that, you know, would very much welcome support from the Centre for Mental Health in terms of how we develop our programmes across the region. So I think that's it from me. 2 final notes in terms of children and young people and older people. They are part of the plan, and we do take a life course approach to public mental health. But it's just in terms, it's very difficult, isn't it, when you focus on topic and populations. They do feature under other priorities, but I just wanted to flag that we do lots of work around children and people's mental health and have a focus on older people's mental health too. So I will share the infographic if people would find that helpful. And yes, happy to take any questions either via email or on the chat. Thanks, Ed.
Thanks so much, Laura. That's fantastically disciplined of you, and I love your whizzy interactive slide thing. I'll never be able to work something like that. But
I can't take any credit at all, and it is kind of other members of the team that drive a lot of this work in terms of prevention. So Lizzie Greenwood, Ryan Rothery, and Rachel Buckley.
it's a team. It's a team effort.
It is a team effort for sure.
And you were mentioning children and young people there, and I used to be the lead member for children and young people in the London Borough of Lambeth, where I'm sorry to say our children's services were not always as they should be, but we learned a lot from Leeds getting 2 outstanding rated children's services, and also you being the UNICEF Child Friendly Cities pilot area, and so you know we certainly learned a lot, and I know Leeds do some exemplary work around children and young people, which obviously has a massive effect on people's lifetime mental health, because if you can give people a good start in life, then they're going to have a better chance to enjoy good mental health throughout their life. So
yes,
congratulations on that too. Fantastic. Laura did mention a voluntary and community sector organisation that they work with called Touchstone, and I'm delighted to say we have their chief executive, Arfan Hanif, who is here to talk about their work, because as we all know, councils are not everything in a community, but they do have a useful kind of commissioning, convening, connecting role, and often it's the voluntary and community sector who are really on the ground and in touch, especially with kind of communities that I'm not going to say harder to reach, but aren't traditionally as well served as others, and the VCS has a great role to play in that. So Arfan, I'll hand over to you.
Thank you, Ed, and afternoon all. It conveniently follows on from what Laura was highlighting. So the importance of the voluntary and community sector, increasingly local authorities, in terms of their functions and services, one area is commissioning and commissioning services from the voluntary and community sector. So as the title suggests, it's how do we harness the power of communities and of lived experience. So if we can move on to the first slide, please. And I'm going to give a bit of a plug about Touchstone. So we've been around for 40 odd years, with a particular expertise working with some of the most deprived communities, Black minority ethnic groups across Leeds as well as West and South Yorkshire. We currently serve around 10,000 service users per year, and we deliver around 50 odd services, which are very holistic, everything from the preventative side to mild to moderate, and working with people with severe mental health conditions in hospitals. We operate in 7 local authority areas in West and South Yorkshire. And the key thing, and this is the key critical thing about the voluntary sector, is we don't work in isolation. Most of our services are part of consortia or collaborations. So currently we have over 100 service delivery partners that we work with. And the key thing for us as a voluntary sector organisation is that we're service user led. We are communities led. We have many volunteers and staff who came into Touchstone as service users, which includes myself. I came into Touchstone as a service user, having travelled through the mental health pathways. So as an organisation, one of the things we really emphasise is the importance of having service user led and co-produced services. So that's a bit about Touchstone. And in terms of public health, in different guises, I think for the last 15 years, we've had public health contracts within Leeds. So we've been very, very fortunate with regards to that. Next slide, please. This probably reinforces some of the things that you already know, the importance of the voluntary and community sector and utilising local groups and organisations in terms of service delivery on the ground. And one of the benefits is the diversity that voluntary community sectors provide, whether it's neighbourhood-based, demographics-based, communities of interest. So it brings a huge diversity in terms of service delivery offers in any local authority areas. We tend to be a lot more responsive compared to our statutory partners, and that was demonstrated during the recent pandemic. What you'll see is the voluntary and community sector can quickly mobilise services on the ground. And linked with that, we're very close to the communities. Often our origins are from the communities itself, and that in turn can bring significant community intelligence and knowledge in terms of commissioning and to inform service delivery going forward. Collaborative, and this is critical. We're very fortunate in Touchstone that we collaborate with a range of partners, which also includes statutory partners in the NHS, local authorities, voluntary and community sectors, but also very small community-based organisations which don't traditionally get the right slice of the pie. And the final thing is value for money, and this is critical for local authorities. We're all aware of the current financial challenges local authorities are facing. And it's recognising that the voluntary sector is a good value for money option. And I'll give an example. We also deliver CBT therapy as part of an NHS contract. Our CBT therapist is the same CBT therapist employed by an NHS trust, yet we're 20% cheaper, delivering the same service. So just recognising the voluntary community sector will be critical to support local authorities when it comes to value for money. Next slide, please. So, as Laura highlighted, so a quick case study. So, being Leeds, we're very fortunate being the lead provider in this Public Health Commissioned mental health service. The key thing for us is to keep people away from hospitals and expensive health pathways, NHS pathways. And that's one of the key things that we want to do through Being You Leeds, where people can be happy, can be healthy, good well-being in their local communities, where they take control in terms of their own health and well-being. Our starting point is asset-based community development. We recognise there are assets in communities, resources in communities that we need to utilise, and unfortunately some of the traditional health models don't really look at assets, tend to look at deficits from a health perspective. We very much have a collaborative service delivery model. We have over half a dozen community-based organisations that we work with, as well as working with the local authority. And in its first quarter, the service was launched in July. We ran over 100 wellbeing groups and activities, which are being led by communities themselves. They've decided what they want, how they want a service or a group to be organised. Another initial short-term success has been we've trained over 88 frontline workers in suicide prevention and mental health first aid. We need to build that capacity in frontline workers to support local communities. And finally, anti-stigma. The real illness is not mental health, it's stigma and the associated discrimination around stigma. So currently we have 20 community-based active volunteers who will work closely with the new anti-stigma partnership which Laura highlighted. And finally, the next slide, and I think this is important, keeping staff well. We've talked about the service delivery functions of local authorities, whether it be cultural, public health, adult social care or children's. Local authorities employ thousands of staff. And something that I highlight within Touchstone itself is that we need to set an example as an employer. So as elected members, as well as senior decision makers, what can we do to ensure that local authority staff's well-being is prioritised and it's seen as a key policy objective, because that will then support service delivery outcomes? And how can local authorities, as large employers, create well-being and anti-stigma culture? So in order to change the world outside in terms of service delivery, I think there also needs to be a focus of how local authorities can support their staff in terms of their own well-being. So that's me. Just wanted to give it a bit of an outline in terms of Touchstone, what we deliver, and also the broader importance of the voluntary sector in terms of any strategy to promote good health and well-being. Thank you.
Thanks so much, Arfan. That was brilliant. Everyone's being so well behaved. I haven't yet got my stickers out saying, you know, you're running out of time yet. So well done. Excellent. Great job. And yeah, really interesting and great to see the word and the action co-production mentioned, because it was kind of fashionable a few years ago to mention. Not everyone did it very well, let's be honest, but it is really important. It's a very important principle, and done well, co-production is an incredibly effective way of empowering people who are often very disempowered, and a lot of mental illness is connected to not having much power. That's why racialized communities, those living in poverty, the young are often have the worst outcomes, and it's no coincidence they're often the most disempowered people in our communities. So if we empower people who are having bad outcomes to take charge and shape and deliver services themselves, that's a good thing in itself, and then those services will become more suitable to their needs as well. And so it's not just some buzzword and fashionable thing. It's a really important way of making services effective and efficient, saving money and doing the job they should do. So really grateful to you for articulating that so well. Moving on from Leeds, there are other bits of Yorkshire and the Humber, of course. There are, including the lovely city. Is it a city now of Hull? Not sure if it's a city. I've promoted you to city. I think that's the job of the monarch to do that. But anyway, I'm going to do it. If you're not a city, you should be. Of course, you should be. Marvellous place, Hull. And we've got Sally Barlow, who's a public health lead, who is going to talk to us about public mental health in that wonderful place.
That's great. Many thanks. Yeah, yes, we are a city. So good afternoon. So my name's Sally Barlow. I'm public health lead at Hull City Council with a remit including mental health and suicide prevention. And it's great to speak today at this launch event. Next slide, please. Great, thank you. So this presentation will very briefly explore the relationship between poverty and mental health, and I will share some programmes of work that are currently being undertaken in Hull to tackle these issues. Next slide, please. So there's obviously several different definitions of poverty. The Joseph Rowntree Foundation definition, which is shown on this slide, really sort of highlights an inability to meet day-to-day minimum needs and to be able to fully participate in society. Next slide, please. This slide touches on inequalities, and inequalities should be noted in the context of how poverty is experienced, and certain groups of people have a higher risk of experiencing poverty. Next slide, please. Mental health impacts. So there's a range of statistics and research findings to support the extent to which poverty negatively impacts on mental health. However, it is a complex picture, and often people have a range of other overlapping issues as explored on this slide. Next slide, please. So in terms of the local picture, so from a Hull perspective, the city does have high levels of deprivation. Hull is the fourth most deprived local authority in England based on the Index of Multiple Deprivation 2019. And overall, 45% of Hull's 166 geographical areas on which the Index of Multiple Deprivation is based fall within the most deprived 10% of areas of England. Next slide, please. So the next sort of 5 slides kind of provide a snapshot of some of the work taking place in Hull to promote positive mental well-being and address the impacts of poverty on individuals, on families and communities. All the examples shown are underpinned with kind of strong partnership working structures that we have in place across health, local authority, the voluntary sector and other anchor institutions. In terms of first 1001 days, Hull is one of 75 local authorities in England to receive government funding to deliver Start for Life and family hubs over 3 financial years, so between 2022 and 2025. There's a range of initiatives under the umbrella of First 1001 Days with some really key partners, including health visiting services and midwifery. And this kind of period, the first 1001 days, is really a period of uniquely rapid growth where babies' brains are shaped by their experiences and environments. So it's hugely significant. The slide really details what this programme means for families in Hull, in that they receive coordinated support from conception through the first 1001 days and beyond. Next slide, please. Family hubs. So we have 8 main hubs across the city with 4 connected sites. Family hubs make a positive difference to parents, carers and children by providing a single access point to services that can help them during challenging periods. Again, partners are heavily involved with programs of work across each of the family hubs. Lots of information on the website familyhubshull.org.uk. And currently, over 80% of all families in Hull with a child under 5 years are registered with a hub. Early impact, we're seeing a sharp increase in our local breastfeeding rates, especially over the last 12 months, to the highest they've ever been. So yeah, really, really interesting progress. Next slide, please. Just to touch on Household Support Fund, which is, I'm sure everyone knows, is government money allocated to councils to support people around cost of living. In Hull, our elected members agreed 6 areas of focus, and I've just highlighted one aspect that sits within the sort of the health aspect, and that's to facilitate the provision of warm spaces. Public Health implemented this initiative last winter and again this winter in partnership with our neighbourhoods and housing team. We have over sort of 30 venues in Hull signed up to the council's warm spaces scheme, and that's really providing free, welcoming, safe space for people to keep warm, but really importantly, being able to access wraparound support at those venues. Next slide, please. Needs assessment. So we've recently undertaken a needs assessment in Hull, which focuses on understanding needs of people with severe and multiple disadvantage. So that includes people who are experiencing poor mental health, experiencing homelessness, harmful use of drug and alcohol, people who are experiencing contact with the criminal justice system, maybe experiencing domestic abusive relationships, and also people who are experiencing the removal of a child or children from their legal care. Hull is working to become a trauma-informed city, and funding from our Changing Futures partnership programme within Hull City Council has made this research possible. The needs assessment is due to be published later this month with a set of co-produced and collaborative recommendations to inform the next steps and kind of future thinking around system and strategic responses to multiple unmet needs. And that's really underpinned by taking a trauma-informed approach. So as a city, we act to prevent trauma and respond with compassion where trauma is present. Next slide, please. And really the last initiative that I just wanted to highlight was around the Poverty Truth Commission. So Hull Public Health commissioned a Poverty Truth Commission in 2022, which brings people together who have experience of struggling against poverty with those decision makers to kind of implement alternative ways of working. It focuses on the key principles of fairness, dignity and respect to frame conversations about poverty in a non-stigmatizing way, ensuring that consideration is given to the experience, needs and rights of the individual. There is an example of a question raised in the Hull Poverty Truth Commission asking why even good quality used carpets were procedurally removed from council properties each time a new tenant moved in. Leading to expense for the new tenant or the discomfort of living in a home without carpets. So a solution was reached, which has now been implemented as policy. Carpets are cleaned when tenancy changes and only unfit for purpose carpets are removed. So that's a positive impact for around 5,000 Hull residents per year. And really kind of looking forward to more policy changes emerging from the Poverty Truth Commission in the months to come. Next slide, please. Yep, so that ends my presentation. Happy to take any questions either later or via the chat now. Thank you for listening, and I'll hand back at this point, Chair.
Thanks so much, Sally. And this is a subject very close to my heart. I think it's so important. The evidence is really clear that if any one thing drives poor mental health outcomes more than anything else, it's poverty. And the way that harms children's childhoods in the way that you've mentioned. One statistic I posted in a chat a policy briefing we did, which I do recommend if you're interested in this topic to everybody, that's got a lot of statistics and information about poverty and mental health. And the one I came across when writing it that really struck me was that children living in the most deprived 20% of communities are 12 times more likely to suffer 4 or more adverse childhood events like neglect and abuse by the time they're 8 years old than children living in the least deprived 20%. And we know that if you experience multiple adverse childhood events like abuse and neglect, your mental health outcomes are sometimes thousands of times more, worse than if you haven't suffered those things. So there's a really clear etiology between child poverty, having traumatic things happen to you as a child, and then having really poor mental health outcomes. So it doesn't take a public health expert to work out that we should really do something to eradicate child poverty, which is perfectly in our gift to do. We just choose not to do it. But I've heard 2 really good examples from the north recently about councils taking proactive measures to do such things. One is Preston's community wealth building model. There was a paper in the Lancet Public Health about 6 months ago that showed by spending more money locally and producing genuinely living wage jobs for the local population, it was associated with a 10% increase in life satisfaction scores and a reduction in antidepressant medication prescriptions. So a real genuine direct benefit to mental health. And the other one was Sheffield City Council changing to a default free school meal registration scheme. So their revenue and benefits team checked which families should be eligible for free school meals but weren't currently claiming it, and they wrote them a polite letter saying you're eligible for this. Unless we hear from you that you don't want to go on the scheme, we're going to put your child on the scheme. And then not only does the child have access to the meal, but the school also gets access to pupil premium money, boosting school revenues in deprived communities as well. So I thought those were 2 really nice practical things that local government can do to address this really important subject. So thank you very much for that, Sally. And again, you stayed on time, even though I'm waffling on, using up everybody else's time. I told you I was the worst one. I'm really speaking to myself. So now we're going to go to Rotherham, another place that has a big place in my heart. I was part of the local government association team that was supporting Rotherham a few years ago now, and I had the great pleasure to go to Rotherham about once a month for a whole year, so I got to know it very well, and a wonderful place it is too. So I will go to Councillor David Roche, who is obviously an elected member, so great to hear from an elected member as well as some wonderful officers in the VCS. We all work together as a team seamlessly, and he, among other things, is the Cabinet Member for Health and Adult Social Care in Rotherham. Over to you, Councillor Roche. You may be on mute because I can't hear you.
Right. So I was just saying that, does this mean if we are here, we get to be made a sit in the near future?
Yes, I have that power. Let's see how this presentation goes, and then I'll bestow it on you.
Good afternoon, and thank you for inviting me. Due to time constraints, we've only got time to go through the high-level strategy elements, but Ruth and myself are more than willing to talk to outside the session to anyone who would like further information. The biggest challenge we had, what we faced in the early days, was in developing a strong, vibrant partnership, working together in an integrated approach and breaking down silos both within and outside the council. It's vital that all those working in mental health at the strategic level are working in the same direction, pulling in the same direction. It's also vital in having a stress on early intervention and prevention. I believe we're well on the way of achieving this, and it started through our Health and Wellbeing Board refreshment in 2017. The slide that's up there now shows the governance arrangements of our Health and Wellbeing Board and Place Board. Like many Health and Wellbeing Boards, in our early days, initially, a lot of arguments, people not pulling together. We stepped back to ensure we built the partnership first. That was crucial to us, to ensure we had a golden thread running through what we wanted to do. And we also ensured that the board had very high level representation from people who could make decisions. They're mostly chief execs or strategic directors. So ours is a fairly large board. It's not seen as a council board in its operation, but as a decision-making partnership. To that end, when place boards came along, we wanted that integrated connection, that joined up thinking. So we've placed our place board under our health and wellbeing board in terms of governance. In turn, we were lucky that when ICP developed, by then the 4 health and wellbeing boards in South Yorkshire had set up a joint board which met regularly. So we were able to persuade our ICS that 75% of nominees to the ICP came from the health and wellbeing boards. So we could push agendas like mental health with an integrated voice. Again, partnership is the key. Slide 2, please. The next slide shows our place plan with its key aim of supporting people and families to live independently in the community with prevention and self-management at the heart. I haven't got time to go through all the elements of this, but the second line down shows the key parts of the overall South Yorkshire ICS plan, followed by line 3 showing how Rotherham's key challenges fits into the ICS and how line 4, mental health, is seen as a key transformational workplace by the ICP. And that was partly made possible by having that joined up approach by the 4 health and wellbeing boards. The penultimate line shows our place principles, and lastly, our main partners such as voluntary services, GP, hospitals, police. By having the governance connection between the Health and Wellbeing Board and place, we can use place as our operational group. Although not down as such, I want to mention also our social prescribing system under our place board is also a key element in helping to promote good mental health. Next slide, please. Slide 3 is our overall health and wellbeing board strategy. Aim 2 in particular deals with mental health, with a focus on promoting better mental health and wellbeing, suicide prevention, along with workplace wellbeing and enhanced access to mental health support. Key parts of this is promoting 5 ways to better health and our Be the One campaign. Aim 2, which is about children's, also has our family hubs there, which has already been referred to today, and our children's mental health. Each aim is backed up by a detailed action plan. The 5 ways is a simple but effective approach. In its simplest way, one of them is about taking time and space to look around you by, say, sitting on a park bench and looking at the trees, looking at the birds, just simply taking time to let your mind go and relax. Be the One was launched in 2019 as Rotherham's suicide prevention campaign after engagement and input from men's groups in Rotherham. The look and feel of this suicide prevention campaign was guided by men with lived experience. Ed has also mentioned the importance of that lived experience and co-production, which I'll come back to. We were also fortunate in persuading some wards to use elected member funding to promote training in these areas, as well as other aspects of work in the mental health field, such as loneliness. You can also see that mental health runs across all our 4 aims. Aim 4, one which I particularly like, the wider determinants of health, includes all our work on loneliness, a key factor in some aspects of mental health. It also includes aspects such as leisure and culture, which can also help in promoting mental health, better mental health. So overall, it's about putting mental health with a high profile and making it work through everything where we can. Again, it's that partnership, working together in an integrated approach. Next slide, please. Following on from this, we decided to apply for the Prevention Concordant for Better Mental Health September 2023. It was driven by our partnership group, Better Mental Health for All. We were delighted to be accepted, particularly as we were told that several examples of good practice was in our submission, such as Be the One, 5 Ways, our mental health partner network, Rotherham, Be Well at Work, and our loneliness plan. All these were done in partnership and are co-produced. bottom bullet point illustrates the further work we're now doing as part of that membership. Slide 5 shows what we are hoping to get out of the concordant, especially learning from good practice elsewhere. We're a great believer in reaching out to other authorities, other people, other organisations to see what they're doing and see if they can help us to improve what we're doing. It works both ways, sharing practice that we've got as well as learning from good practice elsewhere. And you'll see that, again, that strengthening partnership, tackling mental health inequalities, and evidence-based early intervention. Finally, on the final slide, I want to draw your attention to our social value policy, which ensures that every contract we have has a social value element, accounting in some contracts for over 20% of the bidding criteria. We're able to use the funding or the work that we get through this to enhance actions on workplace and also to improve our mental well-being. And also as part of that work we have in that social contract, we also push the fact that everybody who has a contract with us pays the real living wage. Again, Ed has referred to the impact of poverty. So pushing for that real living wage, we feel, is an important part of what we're trying to do. So what we're trying to say in Rotherham is that that partnership, that integrated approach, reaching out, learning good practice, sharing good practice is so vital, along with co-production. Ruth and myself are quite happy to answer any questions on chat now or later. Thank you very much. Under 10 minutes, Ed.
I can't believe it. Maybe I should believe it. My mother's a Yorkshire woman and she's always on time. And so you guys have smashed that. I didn't have to get out my reminder post-its at all. I've got to say, when I saw the agenda and there's so many speakers, I thought there's no way we can get through that. But you've all been incredibly disciplined and we've had some really fantastic material. And Councillor Roche there talking about the importance of partnership. And in this new world where integrated care systems have got a lot more power, it's so important, as wonderful as many of our NHS acute and other trusts are, there can be a danger because they tend to have more money and more power than local authorities for them to dominate these systems. And it's so important that local authorities, with their direct democratic mandate, their delivery of all the different things that have a direct impact on people's mental health, from like all the things we've mentioned, social housing, economic factors, children's welfare, physical environments. It's so important that local authorities and the communities they represent are at the heart of these integrated care systems and other arrangements. And where NHS colleagues, and a lot of them do, understand that role and respect it, and where there's true partnership working between the different parts, we can really get more than the sum of our parts. And the NHS, as well as the communities we all serve, really benefit from that. And I've had some frustrating experiences working on mental health strategies with integrated care systems, not in this region, where NHS colleagues are understandably focused on waiting lists and backlogs and ambulance queues, and they say, oh, we can't be doing with this kind of marmotty social determinant stuff. It's nice to have in a time of plenty, but we don't have time and energy for it right now. We've just got to focus on getting the queue sorted out. Well, meanwhile, lots of people are joining the back of the queue because you're not doing anything to prevent them joining the back of the queue, because they're more impoverished, they've got worse housing, they're breathing air pollution, they're traumatized as children. And so, you can't have one without the other. You've got to treat people well when they need the treatment, but you've got to try to prevent them becoming unwell in the first place by attending to their other social and environmental needs, and local authorities are absolutely critical to that. So thank you for drawing attention to good partnership working. That's what we all want, a good functional family across elected members and officers, NHS, local authority, voluntary and community sectors, and all of the other parts of our wonderful community in Yorkshire and the Humber and beyond. So I don't think I've seen any pressing questions in the chat. If you do, speak very quickly because we've only got a few minutes. But if you do have anything that suddenly occurs to you, do email us. You do have our contacts. Bethan put hers in the chat, but also you'll know how to get through to us, because you've obviously attended this meeting, so therefore you must have got an email from us or other contacts. So do get in touch, especially if you have some interesting policies you'd like us to include in our roundup of good practice. Like I say, it doesn't have to be directly mental health, it can be the things that affects mental health, as we've heard from today. And I'm really grateful to all of our speakers who had wonderful things to say, really interesting, a great breadth across the geography, and voluntary and community sector officers and an elected member, which really shows the strength of local government in mental health, and demonstrated a lot of the different things that we can do together and share together. And I've certainly learned a lot that we'll be taking forward to share with others. So I think we've demonstrated the value of the network. Please do encourage other colleagues to sign up. It's free, it takes seconds. I've put the link in there, and we'll follow up with that. If we can get the more people we can get, the more weight we can give to this, and we can try to persuade central government to fund local government properly. We can try to persuade the NHS to work more collegiately when it doesn't with local government, and we can all work together to create better outcomes with our residents, by doing the stuff that we know is good for people's mental health in the broadest sense, and we've already had that demonstrated today. Lastly, I will thank my colleagues Bethan and Hannah for very capably organising and assisting, making this meeting run remarkably smoothly, giving all the things that could have gone wrong, with various PowerPoints and speakers overrunning, and none of that happens. It's marvellous, marvellous, marvellous. So very grateful. We're actually going to end 2 minutes early, so you can go and have your lunch, have a walk in the sunshine, get some well-being. Let's live as we preach. And Councillor Roche, yes, I will have a word with the King. I'm sure Rotherham will be a city in the next tranche, no doubt at all, no doubt at all. Okay, well, enjoy the rest of your day, and thanks so much for attending.